Welcome to Live Healthy Louisville, the podcast where we dive into the heart of our city's health and wellness. Brought to you by Results by Design Fitness. We are going to bring you local experts, stories, and tips so you can live your healthiest life right here in Louisville.
That's right. And today's guest is very special to us. She's located inside of Results by Design Fitness in a physical therapy business called Foundations Physical Therapy and Wellness. It's Dr. Allie Harper. Dr. Allie Harper is very like-minded when it comes to the approach of fitness and health and bringing it to each person individually so that they can live their healthiest lives possible. In the episode, Dr. Allie discusses what it takes to bridge the gap in between pain-free movement and fitness and life so that you can live life to the fullest and you can accomplish all of your results while living pain-free. And she talks about the foundation of how to build your strongest foundation possible so that you can manage that pain for a change, be listened to, and the steps necessary in order to live that pain-free life. Enjoy, leave comments, and enjoy the episode.
Welcome to the Live Healthy Louisville podcast, where we are going to bring you inspiring stories, practical tips, and local experts so you can live your healthiest life right here in Louisville, Kentucky. Today, we are joined by Dr. Allie Harper.
That's right, and Dr. Allie is going to bring a different approach to the way that we see pain. You know, for the longest time, pain has been this mismanaged principle where we feel like, and we see this at the gym all the time, where we feel like members feel like they have to push through pain in order to get the results that they desire, when in reality, that shouldn't be the case. We should look at a pain from an approach of, you know, where is that pain coming from and how do we build a good foundation around that in order to be successful. And that is why we brought on someone who preaches to build your foundation, Dr. Allie Harper with Foundations Physical Therapy and Wellness.
So, Allie, we have been training people. I've been training people for over 20 years. And I've seen it time and time again. There's two things that happen a lot. Is one is that they come in and they push through pain and they don't move well. And for whatever reason, they seem to never want to go to a physical therapist or any type of physician, doctor, because they're so afraid that they're going to be told not to move.
Mhm. That's super common too. I think pain in general is really misunderstood. We just assume or we're told something is wrong or it's the normal part of aging. So people think that just kind of that no pain, no gain mentality, when pain and the whole pain experience is actually really complex and it's more than just imaging findings or all of these kind of terms that put a negative emotion to it, like degeneration or um, arthritis. Even people kind of have a negative connotation with that. It's just arthritis. I'm just going to have to deal with it. And so I think this really victimizes people and it takes their power away from their situation. And so they don't feel like they can do anything about it. So they're just like, I'm going to deal with it instead of having the tools and the resources to control that pain, because pain really is just an output from the inputs that we're giving it. Our brain is telling us we have pain as a protective mechanism. And there's a lot of things and good inputs we can give the body that will tell us that we don't have pain or that it'll bring down that guard and that protective mechanism.
Well, that makes a lot of sense because, just from, we do a lot of assessing right off the front, right off the bat at Results by Design Fitness. And what we find is a lot of people will, it used to be like my doctor said it's old age, I'm not supposed to squat. And now it seems like it's shifted more towards my doctor says it's arthritis, or my doctor says it's this other certain principle. And it seems like they embody that rather than it being just an obstacle in their life. It becomes a crutch because they start to embody that pain, like, oh, I am someone who has knee pain now, rather than being someone who says, well, despite my knee pain, I'm going to do this,
Yeah,
Mhm.
exactly. I think in the fitness world for so many years, we've preached the message that movement is highly correlated with your metabolism. We know people that move well before they move often. Not only do they not get hurt and they don't have pain, but they get better results.
Mhm.
But yet for some reason, people they don't want to go to a PT before they're injured. They think, oh, physical therapy is just for after surgery. I'm going to work
Mhm.
on my knee replacement or my rotator cuff. But the reality is you can do a lot more.
Yeah, I think a lot of people don't know what physical therapists do. And just kind of like a brief overview in school, you certainly learn like the orthopedic examination. You're going to learn manual skills. You're going to learn how to differential diagnose and make sure there's not something more kind of serious or cynical going on. And, those things are important too, but there's a lot of different settings and avenues you can go down as a physical therapist. You can be in an acute care setting where you're dealing with people who are chronically and very acutely ill, and to know people's critical lab values is especially important. To know how to mobilize somebody who just had open heart surgery or who has all of these risk factors for just literally getting out of bed. You have people who work with the geriatric population, the pediatric population, athletes, pelvic floor, and most people don't realize that it's so broad.
Mhm.
And I think that's why it gets put into this little box of I just go there if I'm injured, where we can really do a lot of screening for just overall health by looking at health markers, biomarkers, and like you said, just metabolic health in general. And,
Right.
and we know that really relates to the pain experience too, just with inflammatory markers in the body when people aren't moving, or it's a dietary thing that's driven the inflammation, or whatever it might be.
Can you break that down? So that brings up a really good point, and I think you can, if someone's listening right now, that they might be able to empathize. Like, what are some of the common, as you say, red flags that you might see, some contraindications early on that someone might be able to identify with that says, hey, like that's me. Maybe it is okay for me to start something despite this.
hmm I'll relate it to kind of just overall energy. So your body needs fuel and energy to make every process in your body happen, to create ATP and energy at the cellular level. So for you guys especially, it relates to how the person is fueling, because
Mhm.
from a fitness standpoint, they're not going to build muscle, they're not going to progress in the gym if they're not fueling properly, and they're not going to lose body fat. And from a healing standpoint or a pain standpoint, it's the same exact thing. Someone who has low bone density, for instance, or they're more susceptible to soft tissue injuries, if they're not getting the proper fuel and resources in the building blocks or the foundation, and you have
Mhm.
holes in those things, then everything else crumbles. And so I would say the same thing for the pain experience too, is again, it's just an output of the inputs that the body is getting. It's the alarm system, and it's by design. The body's telling you, I'm conserving energy, I'm not letting these processes happen on purpose so that you can literally survive. And so if that's at the expense of pain or injury, it's going to do it.
Pain is interesting. I think it's one of those things that is often misunderstood, even by a lot of physical therapists.
Mhm.
And I think one of the common things that I've seen over the years is that a lot of therapists, a lot of chiropractors, a lot of different modalities, they chase the pain,
Mhm.
but a lot of times that's not really the problem.
Yeah. And I'm guilty of that too, especially as a new clinician.
Mhm.
As a new clinician, you're not confident, you don't have your flow, you're not efficient. So you're just trying to get reps in, and you just want to make people feel better.
Yeah.
And so if that's a quick spinal mobilization or soft tissue, drain needling, like I'm still going to do those things even
Mhm.
now as a more experienced clinician, because I know in the moment it can be a really good reset, and it can improve like
Yes.
the buy-in with the patient. If they're more likely to feel better, they're probably going to move better, and they're going to trust you if you've made them feel better. But ultimately, like you said, that is chasing the pain. So if you can't have the conversations with people that again give them the tools and
Mhm.
empower them to take ownership of the situation, then they probably won't get better, or they're going to have a hard time, or they're going to just be stuck in the cyclical cycle or cyclical kind of experience where they might feel better when they see you, but then they're coming back to you in 2 weeks because they feel like they did again, because they're not changing anything outside of the passive treatment that you're giving them. And so I think that's part of it too, is you have to have the conversations or understand everything that goes into the pain experience or into that bucket. Because I'll shout out too to Garrett Salpeter, NewFit. This totally changed like my whole perspective on the pain experiences. And he uses the stress bucket as his example
Mhm.
or analogy, and that you have physical stress, you have emotional stress, you have job stress, you have whatever it might be, illness, overtraining, undertraining, and it all goes into the same bucket. And if that bucket overflows, it can present itself or man itself as physical pain,
Mhm.
as injury, as sleep issues, hormone issues, you name it. Um, Lack of progress in the gym, whatever it might be.
So the pain in and of itself is a manifestation of possibly other underlying issues that maybe even haven't been addressed yet. Like maybe it is our movement, maybe it is our sleep, maybe it is our nutrition, maybe it's a combination, a holistic approach that where we can actually manage the pain without the surgery or without being debilitated. That's a really good point. Someone that is in your shoes, he's a physical therapist and also a strength coach, personal trainer as well, that we just heard from, was mentioning a story about a member that he had that was experiencing chronic low back pain, and he brought in MRI and said, "Hey, they're telling me I need surgery. I think I should go ahead and do it." He's like, "Well, you can have the surgery, but can we make that decision 30 pounds from now?" This was a guy that was overweight. And, long story short, guy comes back 30 pounds, 25, 30 pounds later, back pain free. And it was simply because of the choices that he had made, feeding into his direct biomarkers that were feeding literally his pain that allowed him to finally live pain free.
Yeah.
And nothing structural probably changed from his MRI. And I always explain that to people too, is that you are not your imaging. And imaging is super helpful. If you have an acute break, we need to see what's going on. If you have something, that's persistent or that's not making sense clinically with my examination, I'm like, maybe we need imaging to figure out, are we missing something really big? It's obviously helpful, but people identify with their imaging and they make it their whole personality. And then honestly, a lot of the time that's part of why they can't get better too, is because that's in their head, is that structurally something is wrong with me. I'm broken. I'm never going to get better. And we know from a lot of research studies too, whether it's low back, or there was a specific study too on baseball pitchers and the incidence of labral and I think it was labral or rotator cuff tears, whatever it was, and just if the person was symptomatic or not. I think like 50% of them were symptomatic, but like a crazy number, more than 50%, 75% actually had pathology of their labrum and their rotator cuff, but less than 50% of them were symptomatic. So that just goes to show structure doesn't always mean pain. And you don't know, of course, like what was going on with each of those individuals recovery wise, metabolically, all those other factors that play into pain too.
That's great, Allie. That is awesome. I think I'm sure the listeners out there want to know like what can they do about this and how do they start. But first, I'd like to hear just a little bit like how did you get into PT? Why?
Um, I don't have a super cool story. I grew up as an athlete. I played
Hmm.
sports. So I loved the working out aspect of things. I was always active. I got more into kind of healthy eating and nutrition later into high school. And so that carried over into college. And I ultimately ended up running in college. And from there, I was just pre PT track. So I kind of just was like, yep, that's what I'm going to do. And I did. I got into PT school and I was like, yep, I'm going to work with athletes. And you quickly find out that that's a very like niche population. And while I still do work with
Yeah.
athletes, I think my definition of athlete is not what you see like professional athlete or the people on TV. It's the active adult who wants to get better, who's training for a marathon or playing pickleball 3 days a week or whatever it might be. Those are my people, and that's not where I started. I started working out or working in an orthopedic setting,
Mm.
high volume, lots of different walks of life, and really that's what helped me get reps, and that's what I needed. So as a new grad coming out, you kind of realize you get your degree and then you pass your board exam and you get your license and then you get your first patient in front of you and you're like, I don't know what I'm doing.
Yeah.
And so I'm really thankful for that. I saw everything under the sun. I saw 5-year-olds, I saw 95-year-olds,
Mhm.
balance and fall risk, post stroke, knee replacement, shoulder replacement, ACL, whatever it might be. I probably saw it. And so for that, I gained a lot of skills and I was dabbling in a lot of, self taught education, continuing ed courses, reading research articles, all of those things. And I was sharpening my skills and getting more efficient as a clinician, which is what I needed early on just to
Yeah.
gain confidence and trust with my patients. But I was still seeing all these people come in, and there was something missing still because all these people had a laundry list of diagnosis and medications to go with it to help with that, which came with side effects that created other issues. And what I was seeing is that I could do the best stretch, I could do the best programming, I could dry needle them. And again, we talked about this earlier, like they'd get better short term, but it was just coming back.
Mm-hmm.
And maybe that was because I wasn't giving them all of the empowerment and the tools they needed. But for me, I was taking those things home with me because people weren't getting better. And so I was like, I got to figure out what else I'm missing. So selfishly, I kind of dove into more of the blood chemistry side of things. I was learning about that for like things I was doing in my own life and health. So I was learning about nutrient deficiencies and nutrition and how all those things can impact my own health. But we all know when you start doing those things in your personal life, it trickles into every conversation you have.
Yeah.
And so ultimately, I started just talking more about these things with people. And I was finding that no one was talking about them. No one was talking about these things. So I would just ask people, hey, can I see, do you mind if I look at your labs? And we kind of see if this overlaps with any symptoms you might be having, especially the people in chronic pain,
Mm-hmm.
because they didn't have an acute injury that just caused their pain, where we know something structural is probably happening. There's something else to the puzzle. And I think that goes along with that piece of giving them these tools and empowerment to say, we can fix this with nutrition or help it with nutrition or supplementation, or you're not sleeping. And that's when we recover, whatever it might be. And that was a really pivotal point for me because I was seeing these people had a lot of holes in the foundation. And that's really where foundations came from, is if you don't fix those things, then you're probably not going to see a lot of progress. Even if you see the best physical therapists in the world, you have to address all of these aspects for the patient. So I really wanted to just create a space for people to be able to tell me those things and share their experience, and for me to listen. And where I was before, that was really hard to do. And I think that's hard to do for a lot of people in the healthcare space. We all get into healthcare because we want to help people, or fitness because we want to help people. But when you're in this system of get them in, get them out, and it's time constraint, you don't have the bandwidth to do that. You need one-on-one time with people, more than 15 minutes for like primary care providers or whatever. You need one-on-one time with people to truly listen to them. And so I wanted to create that space for people so that I could have the time to do that and give them that excellent quality of care that ultimately will help them get better versus coming back to see me every 2 weeks.
Yeah, I think that's powerful, especially when you address the whole individual. Like even on people all the time, they're like, "What's the best exercise for me to lose body fat?" We're like, "Well, let's take a step back a little bit. We have a hierarchy of fat loss here. Number one is nutrition, and then we even make it a little joke, and we're like, number two is nutrition. So we analyze what they're doing outside of the gym for the majority of the time before we even analyze what's going on inside of the gym. And yes, we need to individualize exercises for people. Yes, we need to make sure that people are catered to a plan that's right for them. Yes, we need to make sure that we track everything for every individual as far as the fitness component, make changes when necessary, adjust programming for us to be able to create a specific effect. But it all comes down to what that person is doing the majority of the time when they're not seeing you. And I think that's where people fail, is because they identify with that pain and they're only worried about the work they're doing specifically maybe in that joint area, but they're not taking care of the other avenues of life. And they're not monitoring their sleep. They're not making sure that they are emotionally taking care of their spirit, taking care of their emotions, and making sure that they're putting the right things into their bodies to put themselves in a better holistic approach to life.
Mm-hmm.
That's so true. I think over the last 15 years of being in the fitness environment, especially here in Louisville, I've seen this come full circle, right? I was just talking to a client yesterday, and I was talking to her about how she was our very first client, and 15 years ago, strength training, trying to get somebody to strength train was kind of was against the grain,
Hmm.
but now it's a norm. And just like what Ryan's saying and what you said about blood chemistry and the labs and how important they are, how important your sleep is, how important just the holistic being is to getting someone out of pain and healthy. Right now, it's starting to gain traction.
Hmm.
Right. 10 years ago, I was fortunate enough to be able to sit in rooms with Charles Poliquin, Paul Check, a lot of these founding thinkers of these kind of ideas, at least in the fitness community,
Hmm.
and talk about these things. And they are now over the last like 3 to 5 years, I feel like they're getting traction that they haven't had. But
Yeah.
real quickly, my favorite PT line is always, oh, I was going to this PT and I was feeling good, and but I don't feel good anymore. And I know what I'm going to say next because I always ask them, so are you doing your exercises? And they'll be like, oh no,
Yeah, that's
right?
yeah, the bane of my
You ever
existence.
hear that?
Oh yeah.
You ever hear
My
that?
shirt says, but first I have business shirts that say, but first do your PT exercises on the back. And I think, I don't want to totally like degrade patients, but and say, "Oh, you have to do everything," because ultimately it's how we talk to them.
Hmm.
It's the tone we're using. Are you giving them a sense of trust where they feel like they're probably right. I should be doing this. I can do this. If you're just lecturing them, they're not going to do it.
Hmm.
So I think that's a big piece of it too. And people, nowadays too, you said it's gaining a lot of traction. And I think that's created just this overflow of information.
Hmm.
And so people aren't getting the information that they actually need because there's just so much to take in and that's really overwhelming.
Hmm.
And I think that's a big barrier too, is that there's, research tells us how to think, but it doesn't tell us how to treat people or talk to people. And early on as a clinician, that's something I had to learn, just what tone to use, like to make them feel like yes, they can do this and implement all these things. Just that is more important than if I'm good at manual therapy
Right.
or sometimes even exercise prescription, which is super important.
Mhm.
But yeah.
Oftentimes, the best conversations when we initially bring someone in for a starting point session and we're going over their goals. Oftentimes, the most powerful moment is when they understand that we are actually listening to them, and for the first time, someone is actually hearing out what they're experiencing rather than just simply diagnosing and prescribing a plan moving forward. Like they want to know that someone is there and someone is providing that level of care. How do you make people feel that for you? Because I know uh, right off the bat when you first started the business, like people were flocking over to you because they knew that they were going to get something that they haven't previously gotten before. How do you instill that principle that, hey, not only am I here, but I'm going to spend my hours outside of business hours, like building your plan. I'm going to make sure that I'm here for you every step of the way, and this becomes more of a sustainable lifestyle rather than a prescriptive short-term plan.
I think your first visit with whoever you're working with is super important. And I was guilty of this early on. I had a checklist of everything I wanted to check because I wasn't confident and I didn't have that flow.
Mm.
And that's probably just partly growing pains, and you learn and grow as a clinician and become more comfortable and narrow down your examination. But if you can just sit and not be on your computer and let people talk to you, I can write down measurements later. Like I can probably, you know, quickly jot it down and make sure I'm listening to them. That's going to gain trust, number one. And if you just let them talk without asking a bunch of questions, you're probably going to get most of the information that you need. Or just knowing how, what questions to ask to get the information that you need. And if you can do that, that's huge, number one, because they're probably not getting that a lot of other places. They're doing it on an intake form, and then they're going in and they're seeing the provider with split with time with someone else, or they're seeing the provider for 10 minutes. And that's just because business has to be profitable. It's not the provider's fault. That's just how it has to be. Um, but I think that's a big part of it. So I created this space where it's one-on-one, and this model isn't new anymore. It's becoming very
Mhm.
mainstream. So I think people are seeking it out because they've been in the other model and they know that they didn't like it. And so now they're seeking those things, and they know that if somebody's created that model, then they're probably somebody it's going to listen to them and let them tell their story.
I think you both hit the nail on the head. I think the reality is that you have to be able to create a relationship with somebody before you can speak into their life.
Mm-hmm.
Mhm.
And when someone's in pain, they're not thinking about a lot of other things. I've
Mm-hmm.
seen people over the years at the gym and just friends and stuff. When you're in pain, it changes your entire mood. It
Yep.
changes your whole perception of reality and the world, the way you treat people. And if you go into a clinic where you're just another number and somebody's just barking stuff at you and they just say, here, do this, right? That
Mm-hmm.
that person's they're not getting the help they need.
Yeah.
Not getting the help they need.
And I hate that because I was in that situation and I wanted to help everybody that walked through the doors. So again, I think it's, everybody is there to try to help people, but ultimately it gets really hard because nobody has, you don't have the bandwidth at some point to keep up with a really, really high volume, keep up with the research, finish your notes on time, and treat two people at once in my situation. Like you don't have the bandwidth for that.
Hmm.
And so I wasn't okay with that. I wanted to switch and be able to have that balance in my own life and sanity and have the time to treat the patient in front of me. But you're right. Like even the words you speak to people can change things physiologically. Like heart rate can go up, blood pressure can go up. If you've had white coat syndrome before when you walk into an office, that's real. And so those things really do matter. And I've had people that get pissed off at me. I've had people who don't get better or
Hmm.
who I have no effect on. And I think those things were good to happen. It happens to every provider, every clinician, because that shapes who you are and that teaches you lessons on what did I do with that person? How did I talk to
Hmm.
them? Was I having a bad day and I was
Mm,
short with them? All those things matter but ultimately we all go through them
mm,
no matter what your profession is and then you learn from that and
yeah.
you become better.
I just read a book called True Strength. Shout out to Todd Durkin. And Todd is, if anyone knows him, knows that he's the most upbeat, passionate, uh, influential person that you can ever meet. He pours into people. He uses positivity and his faith to guide everything that he does in life. But he was experiencing pain, which in turn brought him down a notch on his positive outlook. And then to compound negativity on top of negativity, the entire book he talks about the doctors he would go to, the people that he would see, the friends that he would confide in, and everyone else was giving him doomsday news. Like he would visit a doctor and they said, your back is the worst I've ever seen it. You're going to have a 14-hour surgery. There's no way around it. I've never seen discs like this before. I've never seen a compressed spine like this before. I've never seen curvature like this before. All of these negative words and negative emotions were feeding him and elevating his pain without him realizing it. He said he would go in and say, my pain is a 7 today. My pain's at 8 today. Some days when I'm stressed out and busy and other things aren't going right in my life, it's a 10. And it wasn't until he finally got a second, third, fourth, fifth, sixth, seventh opinion that a doctor said, You know what, Todd? We may not need surgery. When we can fix this with some other modalities. You're going to have to work hard for it, but I want to let you know that I'm going to be in your corner." And he said immediately his pain went from that 7 or 8 to like a 4 or 5. And how powerful can that be? Simply because someone was in Todd's corner, that now he has a positive outlook to being able to correct the issue, and maybe he doesn't need surgery. That back pain started in 2001 based on what Todd says in his book. And here we are in 2025 when the book was released, and he still has not had surgery. And it was simply because someone said, "I care. Here's some things that I might try before you give up on yourself completely."
Mm-hmm. Yeah, so true.
Yeah, and I know Scott has seen that all time and time again as well. And we just celebrated 15 years of Results by Design Fitness, and there's so many congratulations. There's so many different stories out there of people that are just like the people sitting at home right now that we're told you need to have surgery, or don't ever squat again, or you can give up going to Disney World and playing with your kids. You can give up getting up and down on the floor with your grandkids, and you need to focus on you and your health right now. But that's not you and your health. because your health is taking back some of those things and being able to do some of those things. So how would you start? And I know I kind of have an idea of how I would answer this. Scott, I know he does as well, and I know you do. How would you start if someone at home is saying, "Well, that's great. Like this information is fantastic. I feel like I'm one of those people." What would you start as like a minimal way to just to start something in general? What would you do?
I think I would just say evaluate what you're currently doing. Are you getting 7 to 8 hours of sleep a night? And that's, depending on season of life, that might be hard, but are you going to sleep and having a hard time falling asleep? Are you staying asleep? That's when we're going to heal. Are you eating within an hour of waking up in the morning? Especially if you're a high stress individual, we can know that cortisol raises in the morning to wake us up. And if we don't eat right away, it's going to stay elevated throughout the day. And so if you're a high stress individual who is undernourished, that might be contributing to our stress levels. That might be contributing to our elevated glucose and our metabolic health overall, which ultimately trickles down to hormone health and how we heal from bone and soft tissue injuries. So what's your nutrition like? Are you hydrating? Are you drinking coffee all day? Or are you drinking water and balancing that with electrolytes? Because I think, salt gets demonized too. And this is becoming a little bit more common now. People are understanding that
Thank
electrolytes
goodness.
are necessary. But that's a big thing. I talk about that with a lot of people too. Just hydration is really important. If you're not doing those things, again, from the foundational standpoint, then I wouldn't worry about what specific stretch should I do to fix my issue. Are you getting regular activity? Are you getting out in the sunshine? Are you walking at least? I mean, just something to get your heart rate up a little bit. Those are the bare minimum things. Are you spending time with people that you love, or are you isolated? Bare minimum. After that, I'd get evaluated by somebody that can help you put those pieces together. I wouldn't just Google something, Dr. Google, to see if what that says is matching your symptoms, because not everyone is the same and not everyone needs the same thing for the same reasons. So I would get evaluated by some medical provider that you feel comfortable with and trust, that again can contribute to being in your corner and helping you with that pain experience.
That's awesome. I've had the privilege of having a front row seat for the last 7 years of watching you grow and evolve, and getting to have this conversation first and foremost is awesome. It really is. So thank you for that.
Mm-hmm.
So our listeners, our gym members, the majority of them, they're that 40 to 50 plus crowd, and we know strength is the greatest predictor, or one of the best predictors of longevity.
Mm-hmm.
And if we don't want to let age steal our strength, what do you think are 3 things that they could implement right away to keep that from happening?
So, like you said, strength declines significantly. Even after age 30, you start losing bone mass and muscle mass quickly, especially if you're not keeping up with it with some kind of stimulus or training load.
Mhm.
So strength training, without a doubt.
Mhm.
And then nutrition. So protein are the building blocks for lean mass, so muscle. Those are 2 things, is making sure your nutrition is dialed in with protein, and that's something you guys preach too. Obviously strength training is something you guys preach, and from a physical therapy standpoint too, if you're trying not to lose bone and lose lean mass, you're not trying to get to that osteopenia or osteoporotic state, you need to make sure that you have the proper minerals to do that as well. So I would say that having your blood work looked at least annually from a more optimal lens versus a traditional lens that's looking at just disease prevention,
Mhm.
then that's going to be really valuable to keep you from getting to that, disease standpoint, or that disease end of the spectrum on either end for those traditional lab ranges. I think that's really important too.
That's awesome.
Yeah, perfect. I think the most important part is like your tagline is, and like we preach to our people and you preach to yours, is building that strong foundation early on. What gets measured gets managed, and so we must find ways to understand how to measure those sort of things. So getting your blood work done is managing the parameters that you should be in, right? Because you're looking from a holistic approach of what's actually going in your body, and it's something that you can track because, like you said, if you're doing it annually, you're going to see the results for yourself. Getting your body composition tracked to see where your muscle mass is, see if hitting your protein goal and strength training is congruent with the results over time. So that way you can, if you're managing it and you're measuring it, you can make changes along the way in order to help that process go a little more smoothly and to make sure that you're doing it and sustaining it for long periods of time so you can live your strongest and healthiest life possible and just continue to live life to the fullest.
Yeah, I would say the same thing. Like physical therapy is very subjective and objective measurements. And I think that's important. It improves patient buy-in when they have something tangible in front of them that they can see and they're seeing the progress happen. I think that really gives them the ownership again of their situation if they have something they can see, as well as, if someone comes to you for you guys, they want to lose weight or they want to get stronger, that's subjective, right? They feel that way. They come to me because they have pain. They feel that way. So I think it's just as important to track subjective measurements too, because if you get all of these changes on paper, but they still feel in some way or the original reason they came to see you, then are you really even making that great of an impact? Because that's the true change that I would want to see is, are they feeling a difference?
Well, we know there's a lot of people at the gym, and I know there's probably even more people in Louisville that I don't know if it's fair to say they're having their pain mismanaged, but maybe mislistened to.
Hmm.
They're not being taken, their whole person, their whole being isn't been taken into consideration. They're not getting the results they want. They're not feeling better. They're frustrated. They're fed up. Like, how can they find out more?
Well, I'm inside of Results by Design Fitness. So still working on the signage, but if you see Results by Design Fitness, I'm right in the corner in there. So you can find me there. And then online, I'm on Instagram, allieharper.dpt,
Mhm.
which has the link to my website there as well. Or if you just Google Dr. Allie Harper, Louisville Foundations Physical Therapy and Wellness, I'll pop up there too with my booking site.
Yeah, that's awesome. So,
You can find us at Live Healthy Louisville on Instagram. You can also find us at Results by Design Fitness on Instagram if you're looking to find out more. This is Scott Wilson. I am Ryan Harper. If you have any questions, we'd love to hear from you, or if you got some suggestions for more episodes, you can reach me at ryan@resultsbydesignfitness.com via email, or you can just shoot me a text. 502-586-5544. We'd love to hear from you and love to hear what you're craving as far as bringing the best information to you and making sure that you can live your strongest, healthiest, and longest life possible.
Dr. Harper, thank you.
Thank
Appreciate.
you.
Thanks for being here today.
Yeah, thanks.